Crohn's disease, or sometimes called regional enteritis, is a condition in which you have inflammation in your bowel that has caused symptoms that include diarrhea, abdominal pain, can result in anemia or malnutrition. Crohn's disease is a condition that classically is described as patchy inflammation, meaning some parts of the intestinal tract may be involved and other parts are completely normal and are uninvolved. The most common location for Crohn's disease is the last part of the small intestine called the ileum, right where it attaches to the large intestine or colon. That junction between the small bowel and the colon is also where we have a valve between our small intestine and large intestine, and where in the colon we have billions of bacteria and other organisms living, and in the small bowel we have relatively none. And right at the end of that small intestine where it connects to the large intestine, there's a lot of immune tissue there. It's probably there to protect us and to react to things that are swallowed or bacteria that refluxes into the small intestine. When people have Crohn's disease, they get inflammation in that location or sometimes in other parts of the bowel, and when that inflammation progresses to cause thickening of the bowel wall, it can lead to narrowing of the lumen of the bowel, cramping, or even bowel obstructions. And sometimes the inflammation of Crohn's disease can burrow right through the wall of the bowel into other organs nearby. We call that fistulas. 25% of patients with Crohn's disease will have inflammation in their rectum or around the perianal area, and they can get fistulas that are very uncomfortable around their anus, and we call that perianal Crohn's disease. Some people with Crohn's disease have a type of patchy inflammation that never progresses to any of these complications. So distinguishing between one type of Crohn's disease and another is a very important part of this. Some patients with Crohn's disease will also have what we call extra-intestinal manifestations. That means that the joints hurt, which is the most common, or sometimes they'll have inflammation of one of their eyes or both of their eyes. They can have skin inflammation that can appear as unusual rashes. And then there are some conditions that involve even the spine or the pelvic bones or sometimes the liver and the kidneys. So we have to understand more about an individual patient to know what might be going on. Some of these extra-intestinal manifestations parallel the activity of the bowel inflammation, meaning if you treat the bowel, those other problems go away. An example of that would be the joint pain in many patients or the skin inflammation in many patients. And some of those problems don't parallel the inflammation of the bowel, but we can treat them with some of the same medicines. The challenge to Crohn's disease is that often people have it for a long time before they get diagnosed. That's in part because when you have inflammation of your small intestine, you may not feel it until it's actually progressed to the point where you have some scar tissue or thickening of the bowel. Unfortunately, that makes it harder to treat because by the time a patient gets diagnosed, if there's already scar tissue and some progression of that inflammation, the medicines are less likely to work. That doesn't mean we don't try, however. Some patients will need surgery on their bowel to remove a segment that's inflamed and scarred. It used to be said that people should avoid surgery at all costs because once they had surgery, the disease would come back faster. That's actually not true at all. We now know that surgery is the most effective way to treat a narrowed or obstructed bowel, and that although Crohn's disease may come back in many patients, it is actually easier to treat when we start over with a fresh segment of bowel. Only this time we know the patient has Crohn's and we can monitor for it and take better care of them. The treatments for Crohn's are aimed at turning off this inflammation, preventing progression, preventing that scar tissue, and returning people to a healthy quality of life. This also includes monitoring their laboratory values and their nutritional state, since when you have inflammation of your small intestine especially, you can end up with certain vitamin deficiencies or an iron deficiency anemia. I hope you found this helpful learning about Crohn's disease, and there's much more to be learned which we'll cover in future videos.